She had this encounter with the Lord, and then she was like, I'm going to die. And so she came into the clinic, and she like grabbed my hands, and she was like, pray for me.
Well, welcome again to the Restore Healthcare podcast. I'm Dr. Jennifer Kang, and I'm here with a special guest who is a special friend of mine today, Dr. Kerry McMahon. And before I introduce her, I'd like to just remind you that if you are enjoying this content, I would love for you to like, to subscribe, follow, and give us a 5-star review. That helps us to spread this content to more people like you who could be inspired. Kerry, I'm so happy to have you here with me today. Dr. Kerry McMahon is a maternal fetal medicine specialist who works out of Tacoma, actually in the same Catholic healthcare system that I work in, although we don't get to actually work together. We have become good friends in our quest for restoration in the healthcare sphere and our love that we share for Jesus. Kerry, welcome. Thanks for being with me.
I'm so happy to be here with you. So happy.
Well, tell us a little bit, Kerry. Maybe start with telling us a little bit about your specialty. Of course, I know everything about what you do, but not even medical professionals may all be aware of what you do. Tell us about it.
Yeah. So I'm a high-risk OB specialist, so it's called maternal fetal medicine. And really, I specialize in taking care of moms that have high-risk conditions going on in pregnancy, as well as any kind of babies that have been diagnosed with, anomalies or that we're watching really carefully. So all of my patients, like I'm a consultant, so I'm a specialist, and we work very closely with our OB colleagues, which is awesome. We love them and the midwives. And I have a specialty in, which is funny because I have a specialty in heart disease and pregnancy, but I've always felt like the Lord's like, but that's not just in the natural, that's in the supernatural too. So I have a specialty in heart disease and pregnancy and more ICU care. So that's something I love doing as well.
Wow. For some healthcare professionals, that's very scary. A pregnant woman in the ICU is a scary scenario.
Yeah. I mean, I definitely have had my times where that was a super scary thing. But I think, when you have Jesus and you can take Jesus with you to the ICU, that is just so transformative in terms of how we provide care to patients. Because then all of a sudden, like that really scary patient that's maybe on a ventilator that's not doing well, like, when you bring Jesus with you, then it's like all of a sudden you have all these resources of heaven at your disposal, and you're not limited by what we know in the natural. And so I get so excited to like go to, the ICU and bring patients or bring Jesus with me to see these patients. Cause I'm like, Lord, what are you going to do today? Like, what's on your heart for this patient today?
That is a completely unique perspective. And it really, as you're pointing out, it does source from your confidence and trust in your relationship with Jesus. Tell us a little bit about that. How did this develop in your life? How did you come to meet Jesus? How did you come to bring this into your workplace?
So I, about 15 years ago, I was a fellow and I was taking care of this very sick patient. She had gotten transported into the academic center I was at, and she basically, had about a 95% chance of dying in childbirth. So really, really sick. She had liver failure. She had no platelets. She had ascites. Her spleen was like, I think it was 110 centimeters. Like just I didn't even know it could get that big. She was an alcoholic. She was drug addicted. She had esophageal varices. Like everything that you think would be scary in childbirth, she had. And when I first saw her, she was so angry because she was kind of coming off this like, off being addicted, and just that anger and like the ammonia levels were so high in her brain from the liver failure that she was just angry all the time. And, I was like, I hated going around on her. I hated it because I was like, every time I went in there, she'd just yell at me to get out. Like she didn't want anything to do with me. And I had just come back into walking with the Lord. Like I was probably 2 weeks from just saying, okay, Lord, I trust you. Like I believe in you. I'd been so far away from that for so long. And I started to take care of her. And then the Lord, for the first time, I heard his voice and he said, I want you to pick her up as your patient. And I'm like, I don't want to do that, Lord. Like, she's not very nice. Like, this is not going to be somebody fun to take care of. But I was like, I kept hearing it like, okay, like I need to walk this out. So I picked her up as my patient, and she had gone to rehab, and she had finally sobered up. She wasn't like in that place of like, mental fatigue and like being confused. And she came in to see me in clinic, and she realized she was going to die. And, I mean, for the first time. She had this like, and she happened to get sent to, which I think was just so God, like a Christian rehab. So she was given a Bible when she got there, and she had this encounter with the Lord, and then she was like, I'm gonna die. And so she came into the clinic, and she like grabbed my hands, and she was like, pray for me. And I was like, I didn't even know we could do that. like, like, is this something we're supposed to do? Like, I was so scared. And I took her hands, and I'm like, I don't know what I'm gonna say. I don't know, like, I don't know how this is supposed to look. And I threw up some feeble prayer, like, Lord, like, heal her.
Help her, heal her.
Help her. But through the course of like those weeks, it was probably about 3 months. So through the course of those weeks, I literally just fell in love with her soul. Like, she would come into the waiting room, and I would run out there. Like, I couldn't even wait to see her. And, I just like it, her appearance completely changed to me. That was what the crazy thing was. Like, she was like, she looked probably 20 years older when I first met her than after I started praying with her. And she radiated this like joy, and I just couldn't wait to be in her presence and pray. And the Lord like transformed my heart through that. And then when it came time for her to deliver, and as an OB, like they basically said like her platelets were so low, the blood bank was like, we're not giving you any blood. Like, it's going to go into her spleen, and we're going to drain the blood bank. We're not going to give you any blood. We couldn't give her any kind of like pain medication, like other than, just by IV. Like, she couldn't have a spinal because like she had no platelets, and like, and I was just like, okay, like I was just ready for her to like bleed out during this delivery. And I was so scared.
And everyone was
I was like so
prepared for the
scared.
medical futility of anything
Yeah, I
you
mean,
could do.
what struck me really funny is like people were like okay with it. Like, and I was like, I'm not okay with this. Like I think there's like some kind of an acceptance of like this mortality. And I was like, I'm not okay with that. And I remember my co-fellow at the time, she's like, do you want me to come in with you? Because she was really worried about me watching this patient die
Wow.
that I had gotten such a heart for. So she was standing there with me, and we went to go do the delivery, and she didn't lose a drop of blood. Like, I have never seen that. Like, the baby came out, and then the placenta came out, and there was no blood, and we all just waited for this blood to come, and it never came. And I was like, okay, like one of the greatest miracles I've ever seen. And I was like, okay, like what is this? Like, what is this praying with patients thing that I didn't know about? And I was a little bit angry at first. Like, why don't they teach this to us in medical school? Like, why this is such a beautiful part of someone's health journey. Like, why is this such a foreign thing? Like,
Yeah.
and I just got this, yeah. and I just got this hunger, like, I want more of this. Like, I want more. And I started after that just kind of going on this hunt of like, how do I pray with patients? Like, what does that look like? I'm sure. And I started going to the Bethel, like, the conferences, and I just kind of got this fire in me for healing ministry from that experience.
It sounds like you were confronted with something that you maybe your brain acknowledged could be possible, but you'd never experienced, that God would be present and he would intervene in such a miraculous way that it could not be explained. And this is someone with a very high level of medical skill who most of the time saves her patients. Uh, what an incredible situation to find yourself in and then discover that. Do you feel like it changed your view of God?
Yeah. Yeah. I didn't know. I didn't know he was the God of all things possible.
Wow.
I really didn't. Like I had just started walking with him again and just I was at the beginning phases of that personal relationship and I didn't know this God.
So that started you off on a whole journey of the way that you care for your patients and the way that you interact with your patients. And I think one of the most profound things I've noticed about you is the way that you establish relationship with patients, which is why I wanted to pick your brain and to hear from you, because I think it is a little bit of a catchphrase in current healthcare culture, this idea of having established a good therapeutic relationship with our patients. And there's now a plethora of studies demonstrating that actually there is wholeness, wellness that comes to patients that's beyond just the effect of the medications we give or the surgeries we perform. There's also a measure of healing that comes from the relationship, and that's not completely understood. I think you have a unique perspective on that. Some of the things that are quoted in the literature about what creates a good therapeutic relationship for a patient include, of course, the obvious trust. But how do you build trust? And what other aspects have you discovered as you realized your relationship with God was going to influence your relationship with your patients?
Yeah. I think the first thing, like you nailed it on the head, is like trust. And how do we establish trust in a very short amount of time, if you think about it? And I find that's even more difficult in the last year because there is such a distrust of medicine, and so how do you bridge that gap so that patients don't I'm in your corner, like, and even the opportunity to pray with someone comes through that trust, of like, you can say no if you wanna say no, like, they'll trust me to, like, take them that place, and I'm not trying to proselytize them, I'm just trying to offer this gift of healing God has for them, and for me, like, that starts way before they come into the clinic. So, like, I'm spoiled, I'm a consultant. I get all these records from patients, like, and they're from my OB friends, and they do a great job. So, I know I'm super spoiled that way. I get all the list of their problems, but I really do spend a pretty significant amount of time with each patient's chart, like, going through way beyond just what I get in those records and praying through that. Like, Lord, like, where are the places that you want me to focus? Like, what do you want me to go after for this patient? And so when they come in the door, like, I think, really appreciate that I feel like at least I know them on paper. And I often say to them, hey, like, here's all the things I know about you. This is what's in your chart. Tell me what I don't know. Like, tell me what, like, you think is important that someone hasn't put in that chart, or what's significant to you. And I feel like, we have, I think, on average 7 to 15 minutes per patient. That's not very long. But doing that really cuts out like 15 minutes of time, and then we can get to like what's really going on in your life. I also, like, before I go into any room, I sit outside the door before I see them, and I just say, like, I just pray, like, Lord, like, what do you have for this person today? Like, do you have a word for them? Is there something you want me to go after in terms of healing? Like, is there something that you hunger for them that you want me to be that vessel of, that deliverer of? And sometimes he tells me things, and sometimes he doesn't. And I just go in and try and love them the best I can. Most patients comment to me that, like, they know their doctors are competent, like, they know they're getting good medical care, but they're not sure if doctors care.
Wow.
And that's a real common comment I get.
So
Yeah.
that's like a need that patients feel. You've used this word a couple of times, which is love. And I feel that's so natural for you. Like, you actually would say probably that love is motivating the way that you practice medicine. It seems to be by the way you're talking about your patients.
Yeah.
I'm not sure our professional colleagues would feel comfortable saying that they love their patients. Why do you think that is? And is it okay to love your patients?
Such a good question. Yes, it's okay to love your patients. I think there's a fear. Like, if you connect with someone that you're going to step across this boundary, that, like, you're going to go across some professional boundary, and and it's a place of no return. Like that's what I think, you know. But I will tell you, like, I have boundaries. Like, I think that's important to have professional boundaries. Like, I don't actually, I don't friend my patients unless I know they're never going to be in my care again. Which, for pregnancy, there is like an end to that. Like, but I don't step outside of that, because I think that gets messy. And I want them to see me as someone that cares about them, that loves them, that is their care provider. But I don't want to enter into a two-directional like relationship with them, if that makes sense. So there's that. I've never found a patient has abused that in 15 years. I've never, like, I think most patients are just so hungry for someone to say, look, I see you. Like, I care about you. I've also found like another really interesting thing is this word empathy. We aren't always great in medicine about empathy. And, I can tell sometimes, like, if I diagnose somebody with something, you know, or even just diabetes, even gestational diabetes, to say to them, like, hey, I'm so sorry. That kind of sucks that you have to check your sugars all day. And it sucks that you can't eat donuts anymore. like, I'm sorry. Like, I feel bad for you that you have to go through this, but we're going to take great care of you. And there's just so much shame and blame in medicine. There's so much like, there's so much shame. Patients have a lot of shame. Like, when I say that to patients who have gestational diabetes, like, I'm so sorry you're going through this. We're going to help you with it. A lot of them cry because I feel like it was on them, like they caused this.
Yeah, somehow
and
it's
I
their
and I
fault and they don't deserve care. Hey, Healthcare Tribe, I hope that you have been impacted by what I've brought through this podcast. I also want you to know about opportunities to give back through my nonprofit, Selah Health International. We work to support projects for women and children of vulnerable populations around the world. You can learn more and donate on our website, selahhealthinternational.org.
Yeah. And I think, my other favorite group of patients is my drug addicted patients. I just have such a heart for them.
Oh my goodness. You are
I must
such
be
a
a weird
treasure,
physician.
Kerry.
But I think that, I'd say 95% of them are so motivated to get clean during pregnancy for their baby. They won't do it for themselves, but they'll do it for their baby. And I feel like that is a divine opportunity because they're clean for 9 months or they're transitioning to methadone but they're in a better state of mind that they've been in for a long time. And like, that's the time to speak into their lives. Like, that's the time to show them who God is. And to help them like bridge to a place where they can do it for themselves. And I feel like as healthcare providers, we're missing that. And they feel so much scorn from the world. Like, they come in with such a low self-esteem and so much shame and blame. And it's not to say we're condoning the behavior. Like, that's a different thing. But to see the gold in someone, like to see like that they could be more and to speak to that place and prophesy over them, like I've seen such incredible miracles with that group of patients.
And you stand in so much hope. Like, that may be part of the reason they trust you too. Ever notice that people are magnetically attracted to the person who has hope? And then to on top of that, feel like you genuinely care. And you're demonstrating that in so many ways. You're reviewing their chart. You like take the time to try to get to know them. All of those things are aspects of what we do when we love someone. And to actually say, hey, as healthcare professionals, it's okay to love someone. That feels maybe a little vulnerable. Maybe we have some fears about that kind of vulnerability. To love sets you up to hurt, I suppose. I think some people see it that way. But to love also sets you up to like celebrate joy and restoration too. So it's okay to love our patients, and it's part of what you think is the building block for a trusting relationship. You've seen that.
Yeah, I think it's also like you're laying down this foundation of what God can do. Because if you open that door of someone's heart to love, then you're opening it up really to the love of God. And even if you pray with someone and they trust you and they see an incredible thing happen, and I've seen this so many times, they know it's God. Like, they know it's not you. They know it's God. And that is the end point. Like, it's not the miracle is like the journey to the end point, but God is the end point.
And you wouldn't wanna do what you do without that magic ingredient. Could you ever go back now to the way
No.
you used to
I
practice medicine?
I live that life, no. I mean, I was just like I was a basket case. I was so stressed out. It was part of my conversion. I was literally about ready to have a nervous breakdown. Just the weight of, like, people being sick and, like, and feeling this, like, if they don't do well, it's on me. Like, that was just a lot to carry, and now, like, walking with God, I'm like, "Okay, Lord, like, I'm just doing whatever you call me to do." And sometimes, and I know you and I have talked about this, sometimes that means you do something that no one thinks you should be doing. You're like, "Why are you doing that?" And my answer is like, "Because God told me to do that." Like, but that's those resources of heaven, and that's that stepping out in trust with God to say, "Lord, like, I trust you so much. I'm gonna go against what the medical community says I should be doing because I hear you telling me to do this." And I'm sure that's for my benefit more than the patient's, right? Like God wants us to trust him, but I think that, like, this journey of, like, doing with this God is so much fun. You
And you have gotten to participate in so much fun. Um,
Oh my gosh. I mean, I still get stressed out sometimes, don't get me wrong, right?
that's natural and human, and we reach out beyond ourselves. Would you say that, like, your experience in learning how to build trust with patients out of your trust with the Lord has been a big part of why you've been able to participate in some miraculous stories?
Yeah. Yeah, I mean, I still, like I said, I get nervous sometimes still, like, when things are, like, going sideways. And I'm like, "Lord, like, why are you showing up at the 59th minute?" Like like you could do this quicker, Lord. Like, I still get nervous, but I think that knowing how big he is and what he can do, and it expands my vision of healthcare in such a beautiful way. Because I think that, we should celebrate what God's given us in terms of medical knowledge and wisdom, but there's so much more. There's so much more. Like, we're not at the end of what medicine can do or wants to do, all through God's heart, and so that trust with God is like, it drives me to, like, be so much more open to what is possible. And it helps me dream. Like, I love to dream with the Lord, like, "Lord, like, how do you wanna solve this problem? Like, how do you wanna approach this?" Like, I've had so many times patients come in and there's no medical explanation that can explain, like, what's happening to them, and I love that moment of saying to someone, like, "Look, like, I don't know what's going on with you, but I can sit with you and pray, and we can just pray you through this." Like, and it's amazing what God does even with that, and I don't need to know. Like, as a physician, we always wanna know, right?
Yeah, and we feel like it's our responsibility. Like, we feel a weight, and we feel that pressure sometimes from patients as well to be able to produce for them an answer and a solution. And as we have to sometimes humbly acknowledge, we don't have all of them. We're still missing some knowledge, and we still have gaps in our science, and there's areas where we don't yet know how to fix it. And what do we do in that place? And how do you develop a trusting relationship with the patient in that place? You're saying, I lean on my relationship with the Lord then. I actually have something beyond medicine to offer them, and that is the hope that I carry, and I will sit with them. So you're making a commitment to them, right? Like, I'm going to be here with you. We haven't figured this out. I don't have a medical answer for you, but I'm not going to leave you. And I have someone with me who's not going to
And
leave me either.
we keep taking everything to the Lord. Like, I think that's the other thing, like, it's like the Lord is not just there for the miracle, he's there for the whole journey.
Mm.
So like even with a difficult patient, I can go to him and say, Lord, like, how do you want me to approach this really difficult patient? He's that has been, you know, phenomenal in my practice because we all have had difficult patients, right? I mean, I can tell you a story. Like I had this patient who had schizophrenia and she would come into my office and like I could never address what was going on because whatever I said, she would say the opposite. Like if I said, "Are you having a great day?" and she's like, "No, I'm having a terrible day." "Oh, I'm so sorry you're having a terrible day." "No, I'm having a great day." Like, it was like, "Okay, yeah, off the charts." And I could never address what I needed to address with her, and she would take up so much time. Like, when you're running late, and I don't know about you, but my nurses come in, like, they're pretend like they're getting something in the room to, like, say, "Okay, Dr. McMahon, like, chop, chop." Like, so I couldn't get her, like, to, like, come to a conclusion, like, there was just no way to, like, deal with all of this, and so I went to the Lord and I was just like, "Lord, like, how do you want me to approach her? Like, what does she need? Like, what am I missing?" And he said to me, "I want you to treat her like he said, like, literally the Queen of England. Like, I want you to honor her presence. I want you to tell her you've been waiting all day to see her. Like, I want you to show her how much she is loved by me through your love." And I was like, "Okay." So the next time she came in, I went in there and I was just like, "I've been waiting all day to see you," because I had. Like, I was like, "How's this gonna work out?" And she was like, it like the light switch changed. Like it totally changed her. And she was so appropriate. She was like out of there in like 10 minutes. My staff was freaking out. Like, what just happened? And she was completely appropriate from then on out. Like, but I think that we forget even like with those things, like it's not just the medical, like somebody who's really sick or their baby sick, but it's like in everything we are to call upon the Lord. We are to seek his face. Like he's there for every moment of it. For that difficult coworker, for the difficult patient, for the when we're so tired, like and we just feel like we're burnt out, like, Lord, fill me up. Like in every moment to go after who he is and who he wants to be through us and with us.
Yes. So it's not just limited to, uh, Jesus, come do a supernatural miracle. You were also listening for what would you have me do? And then you do it without understanding sometimes. You're talking about a relationship. You're talking about an ongoing conversation and a willingness to demonstrate his love.
Yeah.
That wouldn't have been probably one of the treatment options for cognitive therapy for this particular patient that we would have found in one of our textbooks to treat her like the Queen of England. And yet it was
And
a
I was like, what does
queen.
that mean, Lord?
Well, he must have known that you did know what that meant. That you had an idea.
Yeah. I was like, I don't know what that means. Am I to bow or something? Like, what does that mean? But I just go where he wants me to go.
Yes. Oh, that's tremendous. That love could be the breakthrough, huh? Love could be the thing that our patients actually need. And it's actually one of the easier things to do if we could just step beyond our fear of that or our mindset about it's weird to love our patients. It's not weird. It's not weird at all. It's what they actually want.
And it gives me so much joy. Like, if I have joy, it's because I get to love people, right? Like, this is what we're supposed to enjoy our jobs.
Wow. So that's another good point, huh? Love actually does end up fulfilling and feeding and filling you back up. There's this innate thing that God created in us that when we give love, we don't have less love. We have more. It's bizarre math, isn't it?
It is bizarre math.
I ask this question to every guest that I have, and I have been just so intrigued by the answers I've gotten because it just demonstrates your own personal connection to God and how you view your place in healthcare. And that is, if Jesus was in your hospital, where do you think or imagine that you would find him?
He was in my well, I feel like he's in every person.
Right.
Yeah, I mean, I feel like, when you encounter someone, like, I always feel this thing of, like, I wanna look for that part of him that's in that person. Like, it's harder sometimes with some people that are difficult. I think we could say, like, for the people that we love in our life, we can see the Christ in them so much easier. But I try and, like, mentally dig around for it when I'm dealing with somebody that's hard, because 'cause I'm like, "But he's still in there." Like, and there's this part of Jesus that's in them that I'm not gonna know that part unless I encounter it in them. And so, yeah, I try really hard to do that. I'm making it sound like I do this all the time. I struggle with it just like everybody else. Like, it's hard when somebody's angry at you or like a patient's really unhappy, but I just keep thinking, but no, like they're an image bearer. Like Jesus is in there. Like, and I want to find that part of him that's in there.
So you're on a treasure hunt to find him all throughout your hospital in the faces and hearts of the people. Wow.
Yeah.
Do you find Jesus then also in the faces and hearts of healthcare workers that you are encountering?
Yeah, I do. And I see how hard healthcare workers work, and their hunger to see healing. That's what I see. But I think that, we can really shift this atmosphere in healthcare by walking in joy and by being someone that is accessing God's heart all the time. Because I have noticed over the years, healthcare workers know I pray. They know I'm seeking that heart of God, and they'll come to me when they're having struggles. Like they know that they can find God. Like, if they can't find him within themselves, they can find it in me because they know I'm going after that. But I think, this is my hunger. Like you and I share this hunger to see healthcare transformed by the presence of Christ. Because I think that there's so many healthcare workers that work so hard that are trying to do the right thing all the time and they're burned out. And the system, I see it becoming more corporate all the time. And I think that that's not God's heart. Like we're losing that personal touch. Like medicine is not a vending machine. You don't go push the button and say, "Well, it's time for my C-section or, my vaginal delivery," or like whatever, like, right? Like it's a personal connection with someone. And I feel like I just see that in healthcare workers, that hunger, and I see Jesus in them too. Yeah.
And you would encourage us that love is one of the secrets. Let your heart love.
I would. Don't be afraid. Take baby steps. Like, don't be, it's easy for me. That's kind of my personality. I get that. But don't be afraid to step out. Don't be afraid to be kinder than you would normally be, and see how that feels. Like, medicine is not, it's not something we should approach with a lack of emotions. And I think oftentimes that lack of emotions, that the lack of joy, the lack of kindness, the lack of love comes through self-protection. Like we've all had that experience where something tragic happened and it just wrecked you, and I think that there's a wall that goes up when that happens. Like I remember when I was a med student, the first time I had to do chest compressions. Like I remember I was a new med student, and they're like, "Okay, your job is to do chest compressions and then stay out of the way." Right? And I remember like we were doing chest compressions on this 17-year-old boy in the ICU. And I looked like there was glass, like I could see his parents on the other side of the room watching us, and we didn't get him back. And I was in it, and he died like right under my arms, like, and that wrecked me. And I didn't know Jesus at that time. And I remember going into the bathroom and crying because I didn't want anyone to see me cry. And I just thought, okay, well, now I need to put this wall up because like I don't want to have access to that pain anymore. But I think when we put the wall up, we put up the wall between our access to love and to like joy and to all these other things too.
Yeah.
And I don't want to live that way. Like, that's not very fun.
It-
Yeah.
There's a fear that can develop, a fear of that kind of loss and pain. But pushing through that into love is always going to be the way forward. And your life and your testimonials definitely speak to that love is the way and love is what we need back in healthcare.
Yeah. And even when things don't go the way we want them to go, when they're painful, it is painful. And that's okay. But we know God's got it. We know he's going to turn that towards something for a greater good. And I know even in my own life, like the things that have been hard in my life have been the chisel that have sculpted me into who I am and continue to hope to be. Like I don't want to live a life, it's gonna sound like a funny thing to say, but a life without suffering, because that doesn't represent Christ. Like the unwounded life is not the life of Christ. And we're called to be like Christ.
And it turns out to be a great privilege, doesn't it?
Yes. And it's fun, people.
It is fun. The life of love.
It's fun.
Yes, so good. Thank you, Kerry, for sharing with us today. This has been a really fun conversation. We could go again, and we will, but
You are a gem.
we have felt very inspired by the challenge that you put in front of us, which is love is worth it. And our patients
Amen.
are hoping that we will recover it in healthcare. It's been a great time here today with Dr. Kerry McMahon from Tacoma, Washington, maternal fetal medicine specialist. Think about the ways in which God would lead you to learn more about love and give away love in healthcare. I've been Dr. Jennifer Kang, and this is the Restore Healthcare Project. Healthcare professionals, I'm so excited to be able to connect with you on issues regarding spiritual needs in healthcare. We want to partner together to see some of the ruined places of healthcare culture restored by hope. Follow us at restorehealthcareproject.org and like and subscribe to our YouTube channel and social media.